Hello everyone, welcome back to the channel Homeopathic Remedy Marvels. Today the topic of discussion is Alzheimer's disease. Alzheimer's is on rise and in our geriatric OPDs we often encounter cases presenting with memory loss. So let's go through it and let's see how homeopathy can work in certain these cases. Now, Alzheimer's is basically a chronically progressive disorder. So it takes years for it to develop, where there is slow loss of memory. Now, this is exclusively seen in geriatric OPDs, elderly group of patients over 60 years of age. And there are certain predisposing factors that we must consider. What are those factors? Now, of course, most important factors is age. So in our elderly groups, this must be considered. Females are more prone to have Alzheimer's than males. Often it is seen that people with positive family history of Alzheimer's disease can have Alzheimer's themselves. Most commonly it is seen in elderly patients who are in the low socio-economic status, or those who have had no educations or low education. Again, patients can have a history of repeated head traumas, head injuries of different kinds. It is seen that there is a genetic predisposition or genetic presence of certain pre-senile genes. Some studies have been done and it is seen that pre-senile genes are responsible, or APP genes are responsible for development of Alzheimer's. Patients who are of Down syndrome can end up having Alzheimer's eventually when they grow old. Now, if we see the pathology of this condition, in our brain, hippocampus is responsible, which is in the temporal lobe, is responsible for memory. Okay, so what happens in the hippocampus areas? It is seen that some neuritic plaque they form, neurofibrillary tangles are formed, and there is deposition of beta amyloid or amyloid angiopathy appears. So these are the pathological presentation of Alzheimer's disease. Now, if you suspect a case to have Alzheimer's, what are the investigation of choice that can be done? Now, in order to rule out any hematoma or head injury or anything like that, of course, CT head is very important. You can go for thyroid function test, because in cases of hypothyroidism, sometimes this can be a presenting problem, but it is reversible. Go for vitamin B12 levels, and then if you see that that case may have tertiary syphilis, you of course advise VDRL test. But essentially, the diagnosis is basically done clinically, so it is a diagnosis of exclusion. You take the case in detail, you ask the history, and then you make the diagnosis. Now let's talk about the clinical features. How do the patient present to us? Clinical features include an episodic loss of memory. So they will tell you that sometimes I'm just sitting and suddenly all of a sudden I'm at loss of words. I don't know, I don't remember. They may later have visual spatial incoordination. Okay, and they may feel lost in very familiar space. In fact, at home they sometimes may feel, am I in an alien space? Okay. So now you can understand that they start to behave like a child who becomes stubborn, and they have to be treated like a small child and looked after. So this is called as Capgras syndrome. Now they may even forget learned motor activity, something that they know how to do it, and then they cannot do that activity, even day-to-day activity. So apraxia can happen. 10% of the patient who actually develop Capgras syndrome may even think that whoever is looking after me, whether any family member or the caretaker, are my enemy. So they will be very agitated. Okay. They can develop language troubles, difficulty in communicating, but never ever the patient will have unconscious state. They will never present like that. Now, if you go for the CT scan of such patients, often it is observed that they present with diffuse cerebral atrophy with enlarged ventricles. But it can be normal also. The scan can come out normal. The final diagnosis is often done by biopsy. Now, whenever we go for biochemical tests, the one that is abnormal is acetylcholine. Acetylcholine will be very much reduced in these patients. Now, when such case comes to a homeopath, we have some group of remedies that can be started along with the occupational therapy of these patients. Just to list out those remedies, you can think of medurinum, cannabis indica, anacardium, ignatia, califos, and one more to add is merxol. So I hope this information is useful, and I hope you'll be able to manage cases of Alzheimer's disease. Thank you very much. Please subscribe my channel.